All right, and we're live, and it's Rebecca Hogue here with Virtually Connecting. And this is a special Virtually Connecting session where we're going to be talking about ePatient advocacy and healthcare and social media, and how patients can, and people that use social media can improve health professions education. And this is a special session for Michelle's class, so I'm going to pass it over to Michelle, and she's going to facilitate.
Thank you so much, Rebecca. Yeah, this is a real privilege. Thank you very much for joining me. My name is Michelle Hagermann. I'm an assistant professor of educational technology at the University of Ottawa in Ottawa, Canada. And I'm teaching an online graduate course right now that focuses on emerging technologies and learning. And I had the privilege to meet Rebecca. Rebecca is doing a PhD here at the University of Ottawa. And I learned about her work and was absolutely fascinated by the initiative she's taking to use social media spaces in many, many important ways to advocate for patients. Many of the students actually in my class are studying health professionals education. So they're doing a master's degree in education, but because they're healthcare professionals, they're of course bringing together, right, learning sciences and their own scientific inquiry through that, health professions lens. And I thought, who better to talk about social media use, particularly for that group of students in my class than Rebecca, who is sort of living at the nexus, right, of those ideas. So I've actually put together a list of questions that we're just going to informally talk about. Rebecca has graciously, given up her time today, and I'll be following Twitter, the hashtag for the course, if there are any students just watching and would like to contribute to the live conversation. The hashtag, as you know, for our course is edu5287, hashtag edu5287. So I'll be watching there. If there are any questions coming in, I'll bring them into Rebecca. Otherwise, students in my class will get the recording, and I'll embed that into our course during our Module 5, which is focused on the use of social media to support learning. So Rebecca, I'd really just love to ask you about the work that you do. Could you just describe it for us and tell us how you are using social media spaces to do that work?
Okay, sure. So in the health field, I got immersed in this actually somewhat accidentally. Oh, well, not accidentally. I was diagnosed with breast cancer. And I was a blogger before that. And so I had this sort of the need to blog about it. And so I created my own blog, bcbecky.com, to go through my experience with breast cancer and actually talk about, all of the different things that I was going through. The other thing I did is that I reached out on Twitter, because I was a user of Twitter before, and I know that Twitter's a great place for information. And it's actually something that we, I've been involved in a little bit with the Canadian Conference on Medical Education and their stuff on social media use. They're actually sort of leaders in the social media in medical education field, in medicine field. But going back on that one. So I actually reached out. I was like, okay, where can I talk to people? Where can I reach out to people? Where can I find people? And so I discovered one of the Twitter chats, which is hashtag BCSM, which is breast cancer social media. And it's actually quite an active community. They meet once a week. It's actually led by a doctor who has expertise in the field, so people can actually ask questions, and they bring in special guests from different places, so you can ask questions and talk about sort of experiences and that kind of stuff. But for me personally, blogging has been interesting, because when you blog and you talk about something like this, you become part of a community. Mm-hmm. And then you start to sort of connect with other bloggers and start reading about their stories and referencing their stories, and you become sort of part of a larger sort of community. And so for me, when I went back to do my PhD, I'm looking at the impact of what my blogging has on other people. Mm-hmm. And in particular, like I find I get really, I'm encouraged to keep writing about my experience, because people leave really emotional comments and really heartfelt comments on my blog. And I get people that tell me things like, reading your blog has helped me understand the experience that my sister had, or reading it helps me better understand the patient experience going through this, or reading it has helped me, for other breast cancer survivors, understand better the experience I had and help me mentally process that experience. And so it's just been really, really powerful to get that out of the experience.
That's amazing. And, you know, when you think about evidence, right? I mean, what counts as evidence, right, of our impact, right? Those personal stories, those personal connections are, they must be just so incredibly moving for you. When
well,
you
and
think
that's
go ahead.
That's
sorry.
actually sort of where my research is going, is that I'm going to be looking at and sort of soliciting stories from people about how different blogs have, like my blog, but as well as other breast cancer blogs, how they have impacted people. And so to try and get those understandings so that we have a better sense of what it means to be a patient blogger.
Yeah, exactly. Rebecca, so one question that I have for you as well is, so you're a patient blogger. When I think about my students, right, who are kind of coming at this question from the professional position, right, can you talk a little bit about how your work sort of intersects with medical professionals and why you see that as important? Maybe what the impact, right, of those interactions has been in your experience?
Sure. And I'll tell a bit of a story, because when I was at a conference, Medicine X conference, I actually met an emergency physician.
Okay.
And she said she follows different patient blogs to help understand things like, you know, what symptoms actually lead to or which diseases.
Yeah.
And what those, so that when somebody comes into the emergency room presenting something, she has a better sense of what that might be, right? And so she understands, is gaining a deeper understanding of that patient experience.
So can I just ask the question? Sorry to interrupt, but was it your interpretation that it was because she had access to patient language, right, in this space, that she was then able to understand patient presentation in her context of work? Is that?
Yeah, exactly. That's exactly. And because it's such a complex, you know, patient language is such a complex thing. So being able to get multiple perspectives for different diseases and stuff like that was very, you know, it was very sort of interesting from that perspective. I've also had one of the particular impacts, and I can talk in the breast cancer space specifically, and the cancer space specifically. One of the infusion nurses that follows blogs. So she follows blogs of patients that have metastatic disease that are on experimental things, particularly so that she can understand what the real side effects are and help prepare her other patients. Because otherwise you get the side effects that the medical or that the pharmaceutical companies are reporting. And that isn't, you know, they're biased to say the least, and doesn't really necessarily reflect what the patient experience is. And so the bloggers that are going out there and writing about it and sharing their detailed experience really help the nurses care for their patients.
That's amazing. That's amazing. Right? I mean, you think about the access, right, to this information that otherwise never would be accessible to healthcare professionals, right?
It's really, you know, blogging has really opened up the patient voice, because medicine has, what's happened in medicine, especially with the turn towards evidence medicine and not narrative medicine, like they've made this sort of the shift. It becomes very, very scientific, and patients become a disease, right? You are this disease. And I'm like, well, that's not me as a whole person. That's just one aspect of me. And blogging allows patients to get their voice out there and be heard. And so from an advocacy perspective, it's like, if you're willing to do it, whether or not you know, there's different ways you can go about it as a patient. You can blog without using your name. You can blog in different ways, but still get your experience out there so that other patients understand it as well. Because as you go through this, you learn coping mechanisms. You learn things that really work and really help. And by sharing those, other patients may learn those things too. Now, it's not always a positive, because in
Okay.
some cases, patients' experiences are not, right or not correct or not, so they need to be balanced, and people need to understand that, that we are still talking about the internet and anyone can say anything.
Of course.
So you do have to scrutinize a little bit, but it doesn't make the experiences any less valuable.
Yeah, so you raised an important point there. So one of the issues that, I mean, every, I guess, educator, right, has to sort of negotiate, are those issues around those issues around sensitive information, right? So I think about classroom teachers, and their concerns are about student identity and sharing, wanting to sort of share the work that they're doing and share examples of student work in social media spaces. But then, of course, there are always these questions about identity and sharing personal information, especially for children. And then, of course, go ahead.
That gets so much more concerning when you're talking about medical education, medical information, and health information.
Yeah,
especially
exactly.
And I'm in the U.S., so especially in the U.S. where insurance companies have access to these things, and so now you have to think about, and employers have access to these things, so you need to think about how much information you really want to put out there. I actually created a 4-week online course available at shouldiblog.org for anybody who's considering blogging, and I use cancer specifically, but it actually could apply to any sort of illness blog if you want to talk about your health experience. And the first week we explore sort of what blogs are, and I think it's the second week we explore sort of how much information do you share, and I think we call it where do you draw the line, right? What do you share? What do you not share? And here it becomes really important about, do you name your doctors, right? Do you name your health? So I've taken a stance that, blogging, my blog is about me and it's my experience. It's not about their experience. It's about my experience. And it's not about them. I have great care team, but I don't name them by name, because it's not their story. And they may not want me to. And you never actually really know when you're talking about someone else how it's going to influence them. And so you just really have to be careful that you keep it as your story, because you can then make that decision.
So has this work been a part of your care? So to what extent does your care team read your voice, listen to your voice as presented in the social media space?
That's a very interesting question. And so I've told all of my caregivers about my blog. For the most part, none of them read it. The ones that do are actually interesting. So I get questions or comments on my blog from my dermatologists. And so because cancer's not their specialty, and so it allows them to better understand my disease so that they can treat me, because I'm not actually, they have their area of specialty. So it's actually the specialists or the subspecialists that are actually getting more from it. When I talked to the emergency medicine doctor about her reading of blogs, she doesn't read blogs from anybody in the city that she lives in, so that she doesn't have the risk of you don't want to read the blog of your patients necessarily as a doctor, because there's information that gets shared there that is not in the clinical context, that could just confuse things and change necessarily your clinical judgment or clinical practice. And I'm not sure that there's some issues of it's not in the health medical record. It's not data that you should be using or whatever. I'm not sure how. There's sort of an interesting. That
raises a really interesting question, doesn't it? I mean, why shouldn't it? I mean, if we think about treating the whole person, if that's the model.
But if you realize how much I write, right? Especially early on in the treatment, I might post 2 or 3. Early on I was posting multiple posts a day. How can one of your doctors actually follow that much information? It is information overload in many ways, and so it really is. the expectation there can't be that expectation.
Yeah.
From that perspective.
Absolutely. I understand that for sure. Let's talk about sort of the ways that you know or have been able to sort of gather evidence, you know, to support of the way that, and it could be about your work or it could be about the work that others do as well. But how have you come to understand, Rebecca, the impact of blogging or sort of sharing information through Twitter on people's ability to then advocate for themselves in healthcare situations? Like, have you been able to connect the dots there so that, you know, when I think about my students, they might have some understanding of the impact, right, of on the learning that these conversations are having? Do you have any? Does that make sense? Do you have any evidence?
It totally does. And I want to explain a little bit of language here because not everybody understands that. So when I say ePatient, I'm talking about patient engagement, and I'm talking about patients that want to take control of their care. When you have a critical diagnosis, not all patients want that, right? So some patients just want the doctor to tell them what to do. Of course. And that's got to be okay. And that, you know, there is that space there. But then there's a series of patients that really do want to take control, and know that they need to in some cases, right? Especially, you know, there's just certain cases and in certain places where you really do have to advocate for yourself because your doctors, you know, are looking at you as a disease, right? And your specialists are very, very good at their diseases, right? They know their area of specialty. And I go to a teaching, you know, big teaching hospital, university hospital, where specialties are so narrow and so sub specialties. Like I have 3 dermatologists because I have one that just looks at my nails. I have another one that does oncology dermatology and looks at not skin cancer, but the effects of chemotherapy on dermatology, right? Like, so those are such narrow specialties. But then they sometimes can lose focus of the bigger picture, right? Of the whole person picture. And so if you're working in that environment, you actually need somebody. And if it's not yourself, it needs to be somebody that, you know, and sometimes it's a nurse navigator or a nurse advocate to guide you and to make sure that your information is getting between the different doctors. Some of the institutions are really, really good at coordinating care. Others are not. And here, one of the issues comes of, I get healthcare from 2 different providers, so 2 different organizations. And so although they may share my electronic record, not all information goes back and forth. So I need to advocate for myself in that space. Where I see it in particular comes up with, like, for example, the metastatic breast cancer community, where people are using, patients in particular are using blogs and social media, blogs and Twitter, to help find clinical trials, to help figure out their next steps. Because the way that metastatic disease works, you have one treatment while it's working, and then once your body starts growing tumors again, you have to change treatments. And you keep going until you run out of treatments, and that's usually when you die, right? That's the progression of the disease and how it happens. But always figuring out that next step. And, you know, sometimes, you know, your doctors can help you get there, but your doctors also are dealing with so many patients.
Yes.
With so many different things. And I actually think that patients, especially patients who want to be engaged in this process, are an underutilized resource, right? If I'm fighting this disease, like while I was on chemo and while I was off, right, I still have a mind. I still have the academic brain. I still have the ability to research. And I can put that to researching my disease, and I can put that to researching treatments, and I can put that to finding out this information and presenting it to my doctors, so that, you know, if they don't already know, because sometimes they do, or sometimes they, it's like, oh yeah, no, that's been debunked, it's the next thing. But at least I'm going in there, you know, with that information and knowing that I'm getting the best care because really it is my body and it is me. So I have a vested interest in making sure
certainly
they get it right.
Absolutely. Yeah, yeah, exactly, exactly. That's really powerful. I mean, and it sounds to me like the work that is possible because of social media, it allows you to start the conversation differently, right, with your healthcare team, right?
Yeah.
So I've done the following, the following reading, and I brought together, information from several information sources, including, right, patient accounts, right, of what happened.
Yeah.
Let's start the conversation here and move towards something that works for me then, right?
Yeah,
Is that
exactly.
how it works?
Yeah, exactly. Exactly. And sometimes, like, again, if you've got an excellent care team that's really, really up to date on everything, sometimes they're like, oh yeah, that was good, but it's not really what we do anymore because we've got something better. So I don't want to, they are still experts in their field, but I'm an expert in my body.
Definitely.
And so if you give me, like, I get given, they understood me well enough that my doctors gave me options, right? So I was given, you can have this chemo treatment or this chemo treatment. Mm-hmm. And so I can go back and, I go back and I look at all of the different side effects of the two treatments. And I know in my body that these are going to be the bigger issues. Mm-hmm. So I can choose the right treatment for me. In the case of, again, this is because I want to be that engaged in my care. And there's research that shows that people who are engaged in their care have better outcomes.
Fascinating.
So.
Super fascinating. So this is kind of an academic question, but because you are an academic, I'm just going to ask it. I mean, and given the focus of our class, which is on, some learning, right? So we're thinking about the interactions of learning and technologies. And we spent some time really in the course thinking about theoretical frameworks for learning and thinking about sort of visions for technology integration and systems of schooling and in context of education. If you sort of think about the work that you're doing in the social media space, Rebecca, and then think about sort of theories of learning that where do you see the interactions? Where are the theoretical sort of frames that inform your work?
So for me, a big one is connectivism.
Okay.
Right. And so
like Papert? Papert? Yep.
And so the idea here is, and I didn't quite get connectivism until I went through the cancer process. Because before that, I'd had some experiences with it. But then all of a sudden, through this, my connected community, and I look at myself as a network scholar. So I know people and I work with people from most of my collaborations have people from all over the world involved in them. So, but when I got diagnosed, some of the, those connections turned into care connections, right? And so they weren't just academic colleagues. Now people are sending me care packages and showing, that kind of care through the connection. And I realized there that it's being a network scholar is more than just, being able to tweet at people, but it's actually to make a human connection with people. And so there was really just, and that was so much more, I don't know, it's a different view of learning, I guess. That sort of emotional, as well as just sort of the, I don't know, it's hard to explain, isn't it?
No, I mean, this is really helpful because, right, we're all sort of exploring sort of those interactions. And in the course, we haven't actually talked explicitly about connectivism. But, now we will, right? So this is great. I mean, that you've kind of highlighted that particular theoretical perspective as really fitting, right?
Yeah.
With your understanding. Go ahead.
Yeah, and what's interesting about that is, like, I'd been involved with MOOCs and so massively open online courses since before the Stanford experiment. So when they were just the connectivist MOOCs, and very much about bringing people together to talk about topics that we were interested in. And so it was, those weren't about broadcasting lectures for people to watch. They
Yeah.
were about posing a question and getting a bunch of people together to answer that, each person to answer that question from their own perspective. It's actually interesting because I think you could connect it to the cognitive flexibility theory of the idea of, we have a complex problem, and so having multiple perspectives helps us better understand that problem. Yeah. And so that actually aligns with actually the research that I'm doing, and part of it is to collect those multiple perspectives because we'll better understand the problem of what learning occurs through blogs by understanding the different perspectives of learning that occurs through blogs.
Yeah, exactly. Super fascinating work, Rebecca.
Thank you.
You've really answered all of the questions that I had. Is there anything that you'd like to add to share with students about your work that we haven't already talked about?
The biggest thing I think is don't be afraid to get out there and start blogging. It was a sort of an interesting thing. I'm teaching a couple of other courses on instructional design, but one of the speakers I had in my class was talking about how important it was for people that are new to their careers to have an internet presence and say something. And for me, on my academic blog, some of the most sought out, some of the most biggest hits I get on my articles are articles that I wrote when I was in class, in epistemology's class or this class or that class, right? And so that's sort of the biggest sort of connection thing. And learn how to use Feedly, learn how to use an RSS reader so that you can not waste time finding things. The things come to you. Because I think that's how you take the most advantage of what's out there. But there's there's a lot to be read and a lot to learn on the internet.
That's for sure. Rebecca, thank you so much for this. I have really appreciated your time, you sharing your expertise. If we wanted to follow up with you, can we just tweet at you at RJ Hogue?
Yes, you can tweet at me, RJ Hogue. Again, how much of my blog is, I don't know if there's a way I can actually post it up here. BC Becky, stands for Breast Cancer Becky, BECKY.com is my illness blog. I actually have a different blog for academic stuff, which I'll post in the blog post with this particular thing. So I'm going to post a quick, I'll have a quick blog post out at virtuallyconnecting.org with this video clip, and I'll post links to my blog and how to connect with me if you want to connect with me.
Brilliant.
I'm happy to answer questions, and I will soon be recruiting for my research study, but not yet.
Fantastic.
Excellent.
Thank you so much.
Thank you so much. Yeah, and thank you, Michelle, for asking. This has been fun.
Great.
With that, we're going to stop the broadcast. And